in choosing which of the SDG targets and indicators were particularly relevant to the Pacific region, chose 4 of the indicators in SDG 1, no poverty. These cover a mix of monetary and non-monetary measures or concepts of poverty, and it was recognised that Pacific communities in many respects have different circumstances to many other parts of the world, so it was important to capture both monetary and non-monetary measures. So it was recognised that if we look solely at the monetary measures, we could mask the true underlying level of poverty in many of our communities. So the indicator that I will talk to now is SDG 1.4.1, which is the proportion of the population living in households with access to basic services. Okay. The official metadata for 1.4.1 refers to essentially 8 to 10 key basic services. Many of these are drawn from other SDG targets, such as water and sanitation, Goal 6, energy, Goal 7, education services, Goal 4, and access to health services, Goal 3. So in many respects we can consider 1.4.1 to be a composite of other relevant SDG targets. The benefit of 1.4.1 is that it can be tailored or localised to reflect national priorities or circumstances, and even subnational circumstances. For instance, if outlying islands don't have access to particular services, maybe we can consider tailoring the indicator to reflect that some things are not seen as essential. As the indicator title suggests, we are dealing with the household unit, and that's where the measurement occurs. And we assume that anyone living in that household has the same access to the services. And while in reality this may not reflect what actually happens, at least we can say a person living in that household has the physical access. Whether or not they can afford or share those services is not part of the indicator. So much of the data needed to calculate this comes from our existing standard core collections, such as the census, the household income and expenditure survey, and the demographic health survey. These have traditionally asked a series of questions about household goods and services, in particular the source and use of utilities such as electricity, water, the type of toilet that the household has access to, and increasingly whether there's internet connectivity, and this is supplemented by questions about ownership of laptops, mobile phones and computers. With most Pacific countries now using CAPI or tablet-based household collection techniques, we are now also in a position to use the GPS locations of households to match to the physical location of services such as hospitals and schools. So this can supplement the questions about whether children are attending school and whether people have sought medical care in the last 12 months. So this gives us a better relationship between where people live and the location of these basic services. But again, it does not allow us to delve deeper into whether people can actually afford these services and whether they are of sufficient quality. So we are essentially limiting ourselves to whether something is accessible. So we know even with free schooling for compulsory school ages, some parents will still be unable to send their children to school due to the associated costs such as uniforms, books and the provision of lunches. Now, assuming we can collect all the data on household access, the actual calculation of the indicator is quite straightforward, as we can see from the following example. Let's look at a make-believe country with 4 households. So essentially all we need is a matrix with our household ID across the top, the number of people living within that household. And down the column we have whether the determined basic services are available. That will allow us then to separate into two categories: households that do meet all the criteria for access to services and those that don't. And then we simply add up the number of people in the households which we've determined as having those services. They become our numerator, and the denominator becomes the total population living in those households. This indicator is relevant since basic services are central to improving living standards, both for the poor and also for the non-poor. People can have unlimited financial resources, but if they are unable to access quality health care or provide education for their children, we can still think of them as living in deprivation. The indicator is also useful for governments to know which sections of the community are missing out and where they may need to direct their investment into things such as communications infrastructure, expanding school services, but also giving the roads and the mobility so that people can get from their home to these services in a safe and affordable manner. So it's hoped that this indicator data will assist government efforts and planning for provision of equitable basic services to reduce poverty for all.